Hi, my name is Christy Bowman, and I am a student nurse here at the University of Pittsburgh.
Hi, my name is Alicia Lewis, and I am a student nurse at the University of Pittsburgh.
Hi, I'm Rebecca Knock. I'm a student nurse at the University of Pittsburgh.
Today we are going to show you how to practice taking blood pressure.
You bought a blood pressure cuff, formerly known as a sphygmomanometer.
Take your sphygmomanometer out of the case. The first thing we're going to concentrate on is to hold the bulb. Initially, you might want to hold it up, pick it up and hold it like this. You will have much more control if you hold the bulb like this.
Place your fingers so that your thumb has control of the knob. You need to use your thumb and index finger together. To open the valve, you want to loosen it. Think lefty-loosey. To close the valve, you want to tighten it. Think righty-tighty.
You'll never find the skill you seek till you pay your dues.
If you don't have someone that's safe to practice taking blood pressure on, use a leg of a table and wrap a towel around it. When practicing on the leg of a table, take a towel and wrap it around to get the size of a person's arm and tape it with adhesive tape. For the rest of this film, we will be practicing on a person.
Blood pressure cuffs come in different sizes. This cuff is made for a baby. This cuff is made for a child. And this cuff is made for an adult. It's very important to choose the right size for your patient. Adults come in all sizes. You have to make sure that the cuff actually fits the patient. Just because it says adult does not mean it will fit. It is very important to line up the artery line with the brachial artery, which is located in the bend of the elbow near the inner side of the arm. You hold the cuff like this, with your thumb here and your thumb here, and you place it on the arm. You wrap the cuff around like this. Place the cuff on the arm and wrap it around like this. You want to place the cuff an inch above the bend in the elbow so that your stethoscope has room to be placed without touching the cuff. With this placement, you can see that I have room to place my stethoscope. If you have extra cuff left, you can get rid of it by folding it like this. The cuff has to be on tightly enough that it does not slide down the arm.
Now you have the cuff on your patient. You want to practice inflating and deflating the cuff. Inflating is easy once you know how high to inflate to. Deflating takes a little more practice. We're going to pump the cuff to 80 and hold the needle there. We're going to let the cuff deflate at 2 millimeters a second. Slow, controlled descent. You know you have to choose the correct size cuff. Good. Okay.
Yeah.
You know that you have to put it on tightly enough so it doesn't move. You know that the cuff has to be placed high enough on the arm so that the stethoscope and cuff do not touch. And you have practiced and practiced the control of the descent of the needle. Now get your stethoscope. When using the stethoscope, make sure the earbuds are facing in towards the ears and not backwards like this. Before using the stethoscope, you want to make sure the part that you're using is on. To test what side the stethoscope is on, take it and blow on each side. It should be obvious which side is on. If you want to turn the other side of the stethoscope on, simply turn here. This is the bell of the stethoscope. This is the diaphragm. We're going to do the blood pressure using the diaphragm. You've already checked for an auscultatory gap, and there is none. That was checked on admission. You've already checked the trends of your patient's blood pressure, and you know she runs 120/80. You also know there is no difference in taking blood pressure in her right and left arm. That was checked on admission. Place the stethoscope over the patient's brachial artery. We're going to pump the cuff up to 150. We're going to listen for the first sound, which is systole. We are going to continue listening to the thumping sounds till we hear the last one, that is diastole. Control the descent of your needle or your measurement will be incorrect. I don't know, I did it if I got like 110/70.
You want to use your non-dominant hand to hold the stethoscope, so your dominant hand is free to control the knob on the blood pressure cuff. A good trick to control the patient's arm is by holding the stethoscope like this, with your thumb and your other hand extended around the arm. I turned it off. I keep turning mine off. 110/70. Now we're going to take a minute to examine some things that students commonly confuse. Taking a blood pressure this way, you can never end up with an odd number. The meter runs in increments of 2. The digital blood pressure cuffs in the hospitals can give you an odd number. You may notice that the needle is bouncing. However, you cannot use this to make your blood pressure reading. The only pulse that you actually hear is the apical pulse. All other pulses you actually feel. If you listen over the brachial artery with a stethoscope without taking a blood pressure reading, you will not hear anything. How do you know when it's not safe to take a blood pressure? You ask the patient. Ms. Lewis, have you ever been told that it is unsafe to take a blood pressure reading in any of your arms? If your patient doesn't know, it is very important to know your patient's history. You can also check the signs in the room and the wristbands on your patient. Sometimes your patient will have more than one wristband, so it is very important to carefully read each wristband.